Okay, let's unpack this. We're about to dive deep into a condition that, well, it touches the lives of so many people.
Hmm.
And it's absolutely critical for anyone looking to understand common mental health challenges, especially, if you're preparing for something like the MSRA.
Absolutely.
Today, our source material is a set of MSRA revision notes specifically focused on generalized anxiety disorder, or GAD.
That's right. And think of this deep dive as your, let's say, high-yield tour through those notes.
Okay.
Our mission is really to pull out the most important details. The definitions, the causes, symptoms, those diagnosis criteria, management approaches, essentially everything you need to grasp UAD thoroughly, but, quickly.
Right.
We're going to walk through these sections together, making sure the key information sticks.
Exactly. We'll go point by point, guiding you through what the notes highlight. Let's jump straight in with the absolute basics. How did these notes actually define generalized anxiety disorder?
Well, the notes start by placing GAD within the broader category of anxiety disorders, describing them generally as persistent feelings of fear, worry, or unease that really impact daily life.
Okay, so that's anxiety in general, but GAD is distinct, right? It's got its own specific features.
Absolutely. The source material makes it very clear. GAD is characterized by chronic, excessive worry.
Chronic excessive, got it.
And crucially, this worry isn't tied to just one specific situation or trigger. It's broad, affecting work, relationships, pretty much all daily activities. The notes really emphasize that the central feature is this excessive worry about various events.
That distinction is key, not just anxiety about one thing, like a phobia, but excessive worry about lots of different things, and it's persistent. The notes also bring in the ICD-11 definition, which gets quite specific, doesn't it?
It does, yeah. ICD-11, as presented in the notes, it specifies marked anxiety symptoms lasting for months.
Months. Okay.
Again, the focus is on excessive worry about a whole range of events. It lists associated symptoms like muscle tension, restlessness, autonomic overactivity, things like a pounding heart or sweating.
Right, the physical side.
Yeah, difficulty concentrating, irritability, and sleep disturbances too. And for it to be GD, these symptoms must cause significant distress or impair functioning.
So it really has to impact life.
Definitely. And you have to rule out other medical conditions or, say, substance effects. There's a note, too, that for children and adolescents, this distress and impairment need to be present for at least 6 months.
So it's not just a bad few works then. It's long-lasting, significantly impacts life, and covers a wide range of worries. The notes explicitly call it a chronic illness, suggesting it needs long-term management, often right there in primary care.
Precisely. Which leads us naturally from the what to the why, the etiology or causes as described in the notes. It's presented as, well, a complex picture.
Right, not a single cause you can just point to.
No, exactly.
Yeah.
The notes explain it involves a mix of genetic, environmental, and neurochemical factors. It seems to be a combination. A genetic predisposition might make someone more vulnerable, and then life experiences or trauma can act as triggers.
And how about the brain chemistry side? The notes mention that specifically.
They do. The source highlights imbalances in certain neurotransmitters, particularly serotonin, dopamine, and GABA, as significant contributors. It even mentions specific neurochemical disruptions and the involvement of particular brain areas playing a role in GAD's development.
Okay, so a real mix of factors. Given that complexity, are there specific groups of people who are maybe more likely to develop GAD? What risk factors do these notes point out?
Yeah, the notes list both general risk factors that can apply to anxiety disorders broadly and some more specific to GAD.
Okay.
So general factors include things like a family history of anxiety, a personal history of trauma or significant stress, chronic medical conditions, substance abuse, certain personality traits, maybe being highly sensitive or perfectionist,
Right.
and those brain chemistry imbalances we just talked about. It also notes that women are generally more prone to anxiety disorders than men.
And narrowing it down specifically to GAD, what stands out there according to the source?
For GAD itself, the notes specifically list female sex, having a lower education level, overall poor health, significant life stressors, being divorced or separated, and living alone or as a lone parent as factors that increase risk.
Okay, that paints a clear picture. Let's get into the nitty-gritty of how GI affects the body and the brain, the pathophysiology. How do the notes describe this? It sounds complex.
They paint a picture of a very complex interaction. It's not just one thing, but an interplay between different brain regions, neurotransmitters, and the body's stress response system.
Okay.
For anxiety disorders generally, the notes mention overactivity or hypersensitivity in the amygdala. That's the part of the brain crucial for processing emotions and particularly fear.
Right, the fear center.
Kinda, yeah. There's also noted dysregulation of neurotransmitters, specifically mentioning low serotonin and high norepinephrine, and issues with the HPA axis, which is the central stress response system in the body.
So the brain is sort of stuck on high alert. Is that a fair way to put it?
That's a pretty good analogy, yeah. And for GAD specifically, the notes point to altered circuits involving the amygdala, the prefrontal cortex, and the limbic system, along with those broader neurotransmitter imbalances we mentioned. All of this working together essentially contributes to that persistent feeling of fear, constant worry, and also the physical anxiety symptoms someone with GAD might experience.
That makes sense. And speaking of symptoms, anxiety is a feature of so many conditions, isn't it? So differentiating GAD from other things must be really important. The notes emphasize this in the differential diagnosis section. What should you be considering?
Yeah, this section is vital for anyone using these notes for revision. You absolutely have to rule out other conditions. The notes list several mental health conditions first: panic disorder, PTSD, OCD, various phobias.
Like social phobia?
Exactly. Social phobia or social anxiety disorder, specific phobias too, and acute stress disorder. You need to distinguish the pervasive worry of GAD from the specific triggers or patterns of these other conditions.
And other conditions where anxiety might be a symptom but isn't the core disorder.
Yes, the notes mention conditions like schizophrenia, dementia, and alcohol dependency, where anxiety can certainly feature prominently. But a crucial point the notes highlight, and this is a common pitfall if you're not careful, is physical conditions that can mimic or trigger anxiety symptoms.
Ah, the physical mimics.
You must rule these out. The notes specifically list hyperthyroidism, certain cardiovascular diseases, respiratory disorders, and critically, substance withdrawal or intoxication. A thorough workup is really needed to make sure it's GAD and not something else masking as it.
Right. That's a key takeaway for clinical practice. Very important. Let's talk numbers now. How common is GAD? What does the epidemiology section of the notes tell us?
Well, anxiety disorders as a whole are very common in the UK population. The notes give specific prevalence figures for GAD. Approximately 6% of UK adults meet the criteria for GAD at some point in their lives.
6%, wow.
Yeah. The estimate for adults in England is slightly lower, around 4.4%.
And specifically within primary care, where many people first present, is it seen a lot there?
Very much so. The notes state that GAD is found in about 7–8% of patients seen in primary care settings.
Okay.
It's noted as being more common in people aged 35–55, and aligning with the risk factors we discussed, it's more prevalent in women. There's also a mention of potential cultural variations, and an important note that GAD is now recognized as being more prevalent in elderly populations than perhaps previously thought.
Interesting.
So yeah, it's a significant part of the primary care workload.
Okay, prevalence numbers are helpful context. Now, how does GAD actually show up in someone? What are the typical clinical features, and how is a diagnosis actually made in the UK, according to these notes?
So the notes list the common signs and symptoms we've touched on. That excessive worry or fear, feeling restless or on edge, irritability, having trouble concentrating, difficulty sleeping, muscle tension and fatigue. Physical symptoms are also common, like a rapid heartbeat, feeling short of breath or sweating. The key thing the notes stress is that for diagnosis, these symptoms have to be persistent and cause significant distress or impair daily functioning. It can't just be fleeting.
So how does a clinician formalize that into a diagnosis based on the UK approach described in the notes? What are the criteria?
Diagnosis in the UK, according to the notes, relies heavily on clinical evaluation. The ICD-10 criteria are detailed. And here's a key memory tip for revision, really useful this one. To diagnose GAD using ICD-10 criteria, you need at least 4 out of 5 specific symptom categories present for most days over a period of at least 6 months.
4 of 5 categories for 6 months. Got it. That sounds like a solid mnemonic right there. What are those 5 categories quickly?
They cover the breadth of symptoms, really. 1. Autonomic arousal symptoms like palpitations, sweating. 2. Physical symptoms, tremor, dry mouth. 3. Mental state symptoms, that core worry, concentration issues. 4. Tension symptoms, muscle tension, restlessness. And 5. Cognitive symptoms, like fears of losing control, feeling constantly on edge.
Yeah, comprehensive.
Yeah. And the notes also mention the GAD-7 questionnaire as a helpful tool.
Ah, yes, the GAD-7.
It's particularly useful for assessing the severity of anxiety symptoms. Higher scores indicate more severe GAD. Memory tip. Just remember, GAD-7 helps gauge severity, doesn't make the diagnosis on its own. Diagnosis, as the notes reinforce, is ultimately by exclusion, meaning you need that comprehensive assessment to rule out all those other potential causes we talked about.
But that makes sense. Clinical picture plus ruling out other things. Which brings us neatly to investigations. If the diagnosis is mainly clinical, what role do investigations play according to these notes? Are there specific tests for GAD?
The notes are very clear on this. Diagnosis is primarily clinical. It's based on taking a thorough history, doing a physical exam, and conducting psychological assessments. Investigations don't diagnose GAD directly.
Okay.
Their main purpose, as highlighted strongly in the notes, is to exclude physical causes.
Right, circling back to that differential diagnosis list again, the physical
Yes.
mimics.
Exactly. The typical investigative workup mentioned to rule out physical illness includes routine blood tests. The notes specifically list a full blood count, FBC, urea and electrolytes, UNEs, and thyroid function tests.
The GFTs.
Standard stuff.
Yeah.
Pretty standard tests to catch common physical mimics like anemia, electrolyte imbalances, or those thyroid problems that can look a lot like anxiety.
And other tests are only done if there's a specific reason, like heart symptoms.
Precisely. The notes state other investigations are done if indicated by the patient's specific symptoms. So, for example, if they report significant chest pain or palpitations, you might consider cardiac investigations like an ECG. If breathing issues are really prominent, maybe a respiratory assessment could be warranted.
Gotcha.
But the core message, emphasized in the notes, is that there are no specific laboratory tests for GAD. It all relies on that thorough psychiatric evaluation and excluding other causes.
Okay, diagnosis confirmed, other things ruled out. Now, the crucial part, management. How do these notes guide us in treating GAD? What's the approach?
The notes describe a multimodal approach, which basically means combining different types of treatment. They highlight that psychotherapy and medication are commonly used together.
Right.
CBT, cognitive behavioral therapy, and SSRIs, those selective serotonin reuptake inhibitors, are mentioned as frequent first choices. The nice stepwise approach for GD is outlined in detail in the notes and is a critical piece for anyone studying this, really important to know.
Okay, walk us through that nice stepwise approach from the notes. How does it work?
Right, it's a tiered system, starting simple and escalating if needed. Step 1 is about initial identification, assessment, giving the patient information and education about GED, and simply monitoring their symptoms for a bit.
Okay, watch and wait, almost.
Kind of, yeah, with education.
Yeah.
If that's not enough or the anxiety is more significant, you move to Step 2, offering low-intensity psychological support. This might include things like guided self-help materials or perhaps psychoeducational groups.
Makes sense. Then Step 3.
If the anxiety is persistent or more severe, Step 3 is where you step things up. You'd offer high-intensity psychological interventions like formal CBT sessions, or you'd start drug treatment.
Okay, the more intensive therapies or meds.
Exactly. And Step 4 is reserved for the really complex or treatment-resistant cases, which would require referral to specialist mental health care.
And specifically on the pharmacological side, the drug treatment, which medications are mentioned as first line in the notes.
The notes state that SSRIs, giving sertraline as an example, are the first choice for drug treatment.
Sertraline, okay.
If SSRIs aren't suitable or tolerated, alternatives listed are duloxetine or venlafaxine, which are SNRIs, serotonin norepinephrine reuptake inhibitors. Pregabalin is mentioned as another option if both SSRIs or SNRIs are not tolerated or prove ineffective.
Right.
And there's a very important caution highlighted. Avoid long-term use of benzodiazepines due to the significant risks of dependence and withdrawal problems.
That's a really key point for practice. And for psychological therapy, CBT is preferred.
Yes, the notes indicate CBT is the preferred psychological therapy. It's typically delivered over 16 to 20 hours, which gives you an idea of the commitment involved. It's quite intensive.
Yeah.
Self-help interventions are also mentioned as being effective, particularly, at the earlier steps of that nice pathway.
And once treatment is underway, what about monitoring and follow-up? Is it just treat and see?
Oh no, definitely not. The notes stress that ongoing monitoring and follow-up are essential. Regular monitoring is needed. Medication reviews should happen relatively frequently at first, maybe every 4 weeks, to check response and side effects.
Okay.
And then importantly, treatment should be continued for at least 1 year after symptoms have improved to help prevent relapse.
A full year, okay.
Yeah. The notes also list other interventions that can be helpful as adjuncts, things like exercise, yoga, mindfulness techniques, and referral to specialist mental health services is, as I said, reserved for those complex cases that aren't responding well to initial management in primary care.
So it sounds like it's a long game with GAD management, requires patience and persistence. What does the prognosis section say about the typical course of the condition? Is it something people recover fully from?
The notes are quite direct here. GAD is typically described as a chronic condition.
Yellow chronic.
However, and this is important for patient reassurance and understanding it can be controlled effectively, the notes mention it often follows a waxing and waning course.
So ups and downs.
Exactly. Meaning symptoms can get better for periods and then worse again over time. And this fluctuating pattern is specifically noted as being common in older individuals as well.
So managing expectations is a big part of it then.
Absolutely. The notes emphasize that long-term support and education are really needed. While it's often chronic, proper treatment and ongoing support can significantly reduce symptoms and improve daily functioning for many people.
That's good to hear.
It just requires ongoing management for sustained symptom control. The general prognosis points also indicate that the outlook varies, depends on how severe the GAD is, whether other conditions like depression are present, and how well someone responds to treatment. But many people do improve significantly with effective management.
And finally, what happens if GAD isn't treated or maybe is poorly managed? What potential complications are listed in the notes? This sounds important.
Yes, this section really underscores the importance of getting diagnosis and treatment right. If untreated or poorly managed, GAD has significant negative consequences. The notes state it severely impairs social and occupational functioning and drastically decreases overall quality of life.
And are there other health risks associated with it beyond the GAD itself?
Yes, the notes point out an increased risk of substance abuse people trying to self-medicate, perhaps.
Yeah.
Also an increased risk of developing depression and other mental health disorders. Comorbidity is common.
Right.
And the chronic stress and anxiety themselves can also contribute to various physical health problems over time, cardiovascular issues, gastrointestinal problems, etc.
There's a particularly serious complication mentioned in the notes too, isn't there?
There is, and it's a crucial point the notes make sure to highlight. Individuals with anxiety disorders, including GAD, unfortunately have a higher risk of self-harm or suicide. This is why, as the notes conclude, prompt diagnosis, appropriate treatment, and consistent ongoing support are absolutely vital. Effective management of GAD isn't just about reducing worry. It's crucial for preventing these really serious complications and supporting a person's overall well-being and safety.
Oh, wow, that really brings home the importance of understanding and treating GAD effectively. We've walked through the notes covering everything from the core definition, that chronic excessive worry, right through to the potential complications if left unchecked.
It really does lay out the landscape of GAD as a chronic, impactful condition that requires a structured, often long-term approach to management, drawing on both psychological and pharmacological strategies, tailored to the individual.
And thinking about that whole picture, how GAD involves this complex mix of persistent mental worry, very real physical symptoms, life factors playing a role, and being a condition that people often live with for a long time with those ups and downs. It really makes you pause, doesn't it?
It does. If we consider this condition that kind of blurs the lines between mind and body so significantly and requires such ongoing care and self-awareness, it raises a really interesting, perhaps provocative question for you to think about.
Go on.
Given this complex interplay of mind and body symptoms and the potential for GAD to be chronic with fluctuating severity, how does our understanding of GAD maybe challenge some traditional views of mental health as solely a mental or purely a physical issue? And what does this mean for how we think about long-term support and self-management strategies that go beyond just the clinical treatments we've discussed?
That's a really deep question, something to definitely mull over. And with that, we've completed our deep dive into generalized anxiety disorder, guided by the key points from those MSRA revision notes. We really hope unpacking these notes has helped clarify and solidify your understanding of GAD.
Remember to come back to these key concepts as you continue your revision. The details, like those diagnostic criteria and the stepwise management, really matter.
Wishing you the very best with all your learning.
And if you're looking for more revision materials and practice questions specifically for the MSRA, you can find them over at passthemsethry.com.
Plus, for additional free resources to help you prepare, definitely head over to freemsra.com.